As coronavirus cases and hospitalizations continue to climb nationwide, sources tell CBS News President Trump has not participated in a White House task force meeting in months. More than 144,000 new infections were reported. Just yesterday, another new record. Nearly 1,900 people died. This is the highest since May. Governors and mayors of big cities are starting to impose more restrictions in an effort to contain the virus. So for more on this and the latest from the White House, we want to bring in Paula Reid. So Paula, if President Trump is not involved in the coronavirus task force, what is happening with the vice president? Because he was supposed to be leading this task force, but we really didn't see very much of him. We haven't seen very much of him connected to the task force, in months. Yeah. So who's in charge here, and what is the task force doing then?
Well, we know the task force, Anne-Marie, is still holding meetings about once a week. And during the past several weeks, especially as in the last few days and weeks before the election, the vice president was not able to participate as much as he had during the earlier months of the pandemic. But we know he chaired a meeting on Monday of the task force, and they were really focused during that meeting on the distribution of therapeutics and of vaccines. That's really their focus right now. But the task force does not meet nearly as often as they did at the beginning of the pandemic. And as we've been reporting here at CBS News, we are setting new daily records for infection. So it is quite a contrast, really, this diminished role of the task force.
I see that the power washing or the yard work or whatever it is continues behind you. That's just going to be the backdrop because we want to continue to talk about the task force and whether or not there are certain areas of that the task force members really wish would be getting a little more attention or a lot more attention from the Trump administration right now.
Yes, I'm right now competing with a leaf blower. I know pretty much every time we talk this week, Anne-Marie, there's something new happening behind me, but this is important stuff, and I want to make sure you can hear me. But yes, in terms of the task force, there is a desire that there be more attention paid to a message, a coherent message about how to slow the spread. That's really not something they're working on right now at the task force, largely because there just isn't consensus between the task force and the White House about how to mitigate. We've seen there have been a lot of mixed messages, but the president, throughout the campaign, he suggested that this pandemic was over or ending, and they have not been, of course, consistent with mitigation efforts here in the West Wing, which is part of why they're seeing yet another outbreak. But that's really an area that a lot of the experts wish there would be more focus on, the health messaging, getting the message out, a more coherent, clear, consistent strategy on how to slow the spread as we set these new records and head into winter.
So I want to talk about some other things happening within the administration. Earlier, you and others reported that the Secretary of Defense, Mark Esper, was fired. We all kind of saw it on Twitter after the president tweeted that information out. There have been some major shakeups at the Pentagon. Are any top health officials concerned that they could be ousted as well during this post-election period? Because certainly some of them have been less vocal. Some of them have been a little more vocal now when it comes to being critical of the way the administration has handled this pandemic.
There's overall certainly a concern, Anne-Marie, that the president could potentially try to fire some of these top health officials. A lot of the reasoning behind the firing of the defense secretary is because they really clashed on this issue of using the military to quash civilian protests. And here, of course, there have been many contradictory statements between the president and his task force members. When it comes to political appointees like the FDA Commissioner Stephen Hahn or HHS Secretary Alex Azar, there is concern that the president could try to fire them just to make a statement or to try to change the leadership over these next maybe 60 some odd days that he's in office. But when it comes to career officials like Dr. Anthony Fauci, the president cannot directly fire Dr. Fauci, but he could remove him or Dr. Birx off the task force. But in January, when President-elect Biden comes in and decides, how he wants to handle his group and the task force, he could absolutely put any of those officials right back on the force.
All right, Paula Reid, thank you so much.